18 Americans, including a British dual national, arrived in Omaha during the pre-dawn hours to begin assessments at the University of Nebraska Medical Center. One passenger who tested positive and later negative for hantavirus before returning to the U.S. was placed in the Nebraska biocontainment unit as a precaution.
We assessed that individual. They are doing well, actually. They currently do not have any symptoms and have a good appetite, although they're very tired, understandably, but it's been a really long journey for these folks.
Another individual experiencing symptoms despite testing negative was transferred to a biocontainment facility at Emory University in Atlanta.
We're being very, very liberal in how we're framing symptoms and monitoring for symptoms here. And so that's how the system is working. It doesn't necessarily mean just because someone has symptoms that they're going to end up having this illness.
A close travel companion with no symptoms also went to Emory for monitoring, while 15 lower-risk passengers quarantine at Nebraska Medical Center in more hotel-like accommodations separate from the biocontainment unit.
All asymptomatic, all very grateful to be here, and we're just waiting for them to rest up, and then we'll do the further assessment.
Observation is expected to last 42 days, the maximum incubation period for the Andes strain involved in the hantavirus outbreak on the cruise ship. And today, health authorities in Maryland announced that they're monitoring 2 residents who were not on the cruise ship, but may have had exposure to one of the cruise ship passengers who got off earlier and was on a flight with them abroad. This follows a similar announcement out of New Jersey, where health authorities last week announced they are monitoring 2 residents who also may have had an in-flight exposure. John?
All right, we'll keep monitoring it. Jonathan Seri for us in Omaha. Jonathan, thank you.